Good morning and welcome. Welcome to the 2020 Impact Festival. We are in the final week of the 5-week festival. Throughout, the Centre for Homelessness Impact, alongside our partners and collaborators, have been creating a space to meet, explore ideas, learn new skills, and to build a shared sense of what we want to achieve in homelessness over these coming months and years. Today's session, Harnessing Implementation Science to Improve Results in Homelessness, will build upon this year's theme, Accelerating Impact, by helping us to understand how implementation science can be used at both local and national levels to improve results. We have found that in the UK, we often have the right policies, but things go awry during implementation. The introduction of the Homelessness Reduction Act in England and the rollout of universal credit being two notable examples. It highlights the fact that has been known in other fields for a while, that the movement for evidence-based practice is not spontaneous, but requires focused efforts. The field of implementation science has developed to address this challenge head-on. It offers a multidisciplinary perspective and systematic approach for the design, evaluation and analysis of programs and policies to enhance implementation. In a rapidly changing world, what does the approach have to offer for those working towards ending homelessness? How is implementation science developing to include innovation and rigorous approaches to the collection, use and analysis of real-world data? To explore these and other questions, we are thrilled to have with us today two fantastic speakers joining us from Australia. Welcome, Robin and Hal. Thank you for making the time to be with us today. And welcome to everyone joining us online, wherever you are. For any questions that come up as the session goes on, people joining us can post them into the Q&A box at the bottom center of your screen, and I will put them to the speakers to answer towards the end of the session. The hashtag for the festival is CHIFest 2020, so please get involved with the conversation on Twitter as well. First, we will hear from Robin Milden, who is the founding executive director of the Centre for Evidence and Implementation. Robin is an international recognized figure in the field of evidence synthesis and translation, implementation science, and program and policy evaluations in health and human services. As well as leading CEI, she is an honorary associate professor with the University of Melbourne, a visiting professor at Yong Lu Lin School of Medicine, National University of Singapore, and the inaugural co-chair of the Knowledge Translation and Implementation Group with the Campbell collaboration. And these are just some of your many achievements, Robin. Welcome again, and over to you to give us an overview of what implementation science is all about, and of course of what your organization does.
Okay, thank you very much, and thank you so much for inviting me to speak in one of your series of webinars. We're doing a little bit of these ourselves associated with our conference, so I know how much work it takes. So I'm thrilled you invited us, and hi to everybody online. I'm going to just use a couple of slides and do a swift kind of almost piece about implementation science and what it could do to help achieve better outcomes in homelessness, both in the UK but globally, and happy to take any questions. And obviously there's a lot more behind this than we'll have time to cover today. So next slide, please. So just a quick thing about CEI, because we're relatively new, particularly in the UK. We opened an office only in December. Talk about opening an office and then coming into a pandemic. That was a super smart idea. But Jane Lewis, who's online right now, is our director who runs the UK office, and we have been delighted to quickly be able to partner with a number of agencies and do a series of projects that include, in main, one of these three areas. So we do a lot of work making sense of the evidence, so gap maps like the Centre's done in the past, evidence synthesis, translation for evidence policy practice. We are known for our work in implementation science, which I am going to focus on today, both using implementation science as a body of research and to enhance our evaluation and research, but also as a way to inform our implementation practice when we partner with both government agencies and donors to help see out the vision of bridging the gap between innovation and ideas and evidence and actual implementation and sustainment over time. And then we do a number of various evaluations across a number of sectors, using some innovative methods to be able to come up with the reality of policy on the run and programs need to be in place at a certain time. So that's in general our areas. Next slide, please. So one of the things about, and I'm not going to speak directly to the slides essentially, but for those of you not familiar with implementation science, it essentially emerged quite a number of years ago, mainly from health. And it emerged from this concern of how long it was taking to bridge the gap between things we know we can help people through an evidence base and getting that implemented in a sustainable way. And what I mean by that, effective implementation can be essentially thought of as something goes from something being new to being business as usual, and that it becomes just a regular routine of services. I'm going to use the word innovation throughout this. What I mean by that is policies, practices, what some would term evidence-informed or evidence-based innovations. It is the thing that you're trying to kind of go from idea and evidence into practice and back. So implementation science is the study of barriers and facilitators to achieving effective implementation. And the practice of implementation is using that research in practice for everything that you're trying to do. It is, in essence, interdisciplinary. It is, in essence, a team sport. And it has really taken off, particularly in the last sort of 15 to 10 years in sectors like child welfare, child protection, early childhood, family services, public health. And the good thing about implementation science is it's not sort of discipline specific. It's something that can move across many different areas of work. And it was fun sort of preparing for today, thinking about how it could apply to the homelessness sector. And I'll talk to that in a minute. But there is, me and a couple of colleagues, Bianca Albers and Aaron Schlonsky, recently put together an edited book. And that book is titled Implementation 3.0. And what we were trying to do is articulate what is the area of implementation science learnt over the last sort of 3 decades and what's there still to do. And this slide here is talking about, there are some common, what you would refer evidence-informed or research-informed implementation strategies, if you like, that have pretty much been shown in a number of studies to be consistent with what we know about successful implementation. One thing is, it always occurs in stages. There are over 80 implementation frameworks published in the academic literature. We are calling for no more implementation frameworks. There are a number. They have a lot of similarities to them. A lot of them have phases, sort of how implementation is staged. They've developed these frameworks through studying the process naturally. A lot of them will have strategies, what could or should be done at each stage. This one that's referenced here, QIF, sorry, it's an acronym. It's called the Quality Implementation Framework. It was a person who synthesized 25 other implementation frameworks and said, here's what's common. We use implementation frameworks in a lot of our practice when we are engaged by various groups to help take an evidence approach or an innovation into policy and practice. And they're excellent in terms of helping you stick to certain phases, but also for creating a common language. Sometimes the problem with doing implementation work is people are using different language all the time, and that can create barriers. One thing that we also know from the implementation science literature is that it requires an assessment of need prior to implementation. So a very good colleague of mine and Jane's at the National Implementation Research Network in the US coined a term, pay now or pay later. So what's common in these implementation frameworks is there's always a planning phase. And it's where you're thinking really carefully about your innovation, but also what are the common implementation strategies we need to put in place to enable better implementation, and often using our best guesses or our experience. But there are the whole sort of readiness assessments of looking to what extent our sites, areas, whatever you're sort of working with, to what extent are they ready to begin the implementation? And it's often characterized by 3 things. 1, motivation to implement the innovation or change. 2, skills and expertise with the innovation. It's very difficult to try and implement something that nobody knows very much about or how to do. And I'm not even being sarcastic with that. And 3, organizational infrastructure or system infrastructure, the things that need to be present to enable that better implementation. And Hal, I noticed when I had a little peek at your slides, you have some of that, which I would think about as implementation infrastructure, which I think has caused problems with implementing things. So that is a whole area of implementation science. And depends on the readiness of individuals and organizations. That's been shown to be quite true. The adaptation, I'll tell you, in a hot topic in implementation science, if everyone wants to do a PhD, is this whole thing around fidelity and adaptation. To what extent do you need to remain strictly true to the innovation and how it is said it needs to be done versus and, it's not an either or, and the extent to which local adaptation can occur to account for context. And really, some of my implementation science colleagues might argue with us about this, but it's really landing on the need for context. Context is king. Systems trump programs every time. And so taking that into account in your implementation work is shown to be quite important, especially for sustainability. And Hal and I could give you a ton of examples, both in Australia, but in other countries we've worked in. It really does, to do good implementation work, there's always some capacity or capability that needs to be built, whether it's from the implementation science world itself or the local providers or the policymakers. There's always some infrastructure. I've commented on that. And although everybody talks about this, it's impossible to translate implementation science into practice without data that helps you understand a couple of things. Are we reaching the people that we intended to reach? Are we implementing in the way that we planned? And are we achieving those outcomes? And then using that data to rapidly try and improve. And everyone sort of talks about, rapid improvement cycles and database decision-making, but it really is very difficult to do implementation work without it. And it's also difficult to do with very average data because you're sort of now making conclusions that aren't quite right. So those are the sort of some of the common knowns. Next slide. I don't know why I yelled that then. I was like, next slide, like Hannah's in the next room. So this is what I call the 3 eggs. This is something I thought would be helpful because I think sometimes with homelessness work, it's talking about, people talk about implementing or implementation science, and they also talk about scaling. Like you implement and then you scale, like it's this kind of linear. That's really not true. Because when you think about the problem or the challenge of scaling, that is, if you take it as you want to get to about 70% of the intended population that you're trying to reach, that is kind of the loose global kind of, agreement about what scaling is. How would you scale? That, to do that, is very different than taking a widget, like a peer-to-peer program for people with mental health issues needing to be implemented in 5 local areas. That's kind of what I call as a widget. And you can take a nice implementation framework, get some nice research-informed strategies and work alongside sites to either build their capacity to draw on implementation or achieve it themselves to go from idea to sustainability. Scaling, I think, is a different issue. And I've been thinking a lot about this in terms of some major reform work happening in Australia around mental health, where they're trying to basically do a number of things across recommendations over, the sector. So some colleagues of ours in the US, David Chambers et al., wrote what is a conceptual paper. It's theoretical, but they were trying to think about what do you need to focus on when you're trying to scale something. And the reason I think this is helpful is it shows that it's really important, and this would bear out in our experience, that we have an intervention. So this 3-egg thing has come from health. So the context would need to be adapted, but there's an intervention, there's an innovation, there's a what. And that thing has components to it. It has practitioners, it has some outcomes it's trying to achieve. It has a place it's going to be delivered. So that could be a policy innovation equally, so there's that. But that often sits in a context of a practice setting, an agency, a community setting. So that practice setting or that community setting has an effect on whether or not that intervention or innovation will be implemented. So for example, we rely far too much on implementing innovations in mental health with just training by itself, which has been shown over and over and again in the research not to work. Right? You're better off almost, so we talk about training plus models. But there's a whole context that you need to think about. So staffing, the culture of the organization has shown to affect whether or not implementation will be achievable, sometimes the business models. And then that sits in this huge system, this ecological system, they call it here, or wider kind of systems governance context. And to get to scale, what the hypothesis here is the intervention needs to be able to fit in the practice setting, and it needs to be able to fit in the system. But you have to intervene at all those three levels. So just intervening with the intervention will not enable it to fit better in the context or to fit better in the wider system, and vice versa. So when we're talking about taking big innovations to scale in some way, we're thinking about what can we do as an implementation team at each level to enable some adaptation or change to happen to allow that innovation to stick better. And I was thinking a lot about, Lydia, in the context of homelessness and the work that you're trying to do. And when I was looking through your gap maps, a lot of that are scaling problems. So you can see there's policy barriers, and then there's organizational barriers, and then there's intervention barriers. So what you would do in that case is you would design your implementation intervention to directly address those barriers, which is what's so cool about that gap map, because it ahead of time gives us hints about what might be happening. There are also some very cool tools in implementation science that enable you to better assess barriers and facilitators ahead of time to then design your implementation plan based on what you think you can do about them across these three areas. So that was sort of that's what we should do, I think. Next slide. I'm almost. So we did a little bit of work, and again, this has kind of gone to big conceptual things down to me attempting just to be a little practical. One of the questions we were asked recently from policymakers is, how do we maintain the changes both at behavior and systems level post-COVID? And from an implementation science point of view, this is the sort of layperson summary we came up with for policy. So being clear on the aim. Some of these seem like no-brainers, but you would be, I mean, I don't think anyone actually would be shocked how often it doesn't happen, but understand context and the strategies and the dynamics within that context and how we can support or address them. I said earlier, implementation is a team sport. In the implementation science literature, there's some very nice evidence around the effectiveness of coalition and or implementation teams working together to address and come up with implementation plans for that innovation. And those teams need people with expertise in the innovation, understanding of the policy setting, ideally some implementation science background to bring that, but they're interdisciplinary teams working together to solve problems, which we do a lot of work with government, and we try to repurpose their governance to that, and Hal will know better than anyone how hard that is, but we try. Be purposeful in the implementation strategies. So there are over, again, 80 different implementation strategies documented in the implementation science literature, that some have more levels of evidence about them being effective than others. And what you're thinking about is, it always takes more than one implementation strategy, but we shouldn't have to have 100. The system won't take it. So being very deliberate in a kind of how low can you go? What's our best bets for the minimum amount of implementation strategies we can put in place? And if it doesn't work, add or take out and kind of scale them up and down, if you like. But also, and again, going to the gap map the center's already developed, that's a real opportunity to think about addressing those barriers that the literature and the and kind of lift those enablers up, which is why, you know, congratulations, it was a delightful as an implementation person gap map to read. And then think of scaling as something a little bit different, and thinking about that from the outset and how sustainable things are. Next slide. This is a little ad we get. So next time you want to talk about this, we do these events in Australia, and because of COVID, we've gone online, and we're doing it in a time-friendly zone for the UK with its own special little sub-event. So we're inviting people to submit. We'll do something a little bit in person in Sydney, but we're deliberately designing it to be a really nice experience for people that would be joining online. And again, it'll unfortunately won't be time zone friendly for the US, but we're going to go up what I call the Australian Singapore UK corridor. Think about what you want to put in, We promise the event, if you're online, will be fun. It's all about the use of evidence and implementation, exactly what Work Centre is about, and our other colleagues. It is a good time, and we'll do something probably with the Evidence Quarter team to give people in London something to go to as well. That's it. Last slide.
Thank you so much, Robin. And we will go back to
He's ready.
Oh, I see. I stopped seeing you there for a second, but you can still hear me, which is
Yes.
which is fantastic. So we will go back to some of the themes of the things you discussed. You know, the importance of behavioral change, capacity building. Something you said around the fact that training doesn't always work. That seems important to explore. But before we do all of that, I really want to bring Hal into the conversation to really bring the homelessness perspective, if you like, both from the Australian and UK prism. And Hal Paulson is Professor of Housing Research and Policy and Associate Director at the City Futures Research Centre at the University of New South Wales. And in this role, he has led several major research projects funded by the Australian Housing and Urban Research Institute and by the Australian Research Council. Hal's key interests include private rentals housing, social and affordable housing, and urban renewal. And before moving to Sydney, Hal, of course, worked at Heriot-Watt University, Edinburgh, from 1995 and 2011, before he passed the baton to, of course, Professor Suzanne Fitzpatrick. Over to you, Hal. It's great to have you here today.
Thanks very much, Ligia. And thanks for inviting me. Hannah's in control of the slides. Flip to slide 1, please. Slide 2, I guess it would be. Just to give you a bit of background first, this is a presentation that draws on some research that's currently ongoing at the moment, which is trying to build, or it's beginning to build a series which is parallel with the UK homelessness monitor that some of you, I hope, on the call might be aware of already, and which has been going for 10 years now, very largely thanks to Ligia, in fact. We've only been operating a parallel series in Australia for the last, well, the first one was 2018, the one you can see on your screen, and we're currently working on the follow-up to that. And this presentation actually benefits from very lucky timing, actually, that I'm able to tell you will give you a bit of an insight that comes out of that research that's not published yet. I just give credit to my colleague, Dr. Cameron Parcell at the University of Queensland, who's one of the co-authors on this project, or the other major co-author on this project. And Cameron, as the Australian person on the call, and maybe some of you in the UK also will be aware, is one of Australia's top homelessness experts, and far more experts on this topic than I am. We're about to submit our final report from the 2020 research fieldwork, and that we hope will be published in September. Next slide, please. So I think I need to give you some administrative context here, because the way that governance is set up in Australia is so significantly different from the UK as it relates to homelessness. So the critical, one of the biggest differences is that we have two main levels of government, the federal level and the state or territory level, state and territory level, of which there are 8 across Australia, New South Wales being one. And it is the state and territory governments that have the main responsibility for social housing and for managing housing need, including homelessness. Local government exists. We do have a third level of government at the lowest level, but it's far less significant in general compared with the UK around housing and homelessness. It doesn't have housing or homelessness responsibilities or powers in general. There are a few exceptions. There are local councils that represent the centres of Australia's largest cities that don't have any more legal power than any of the others, but they do typically have a lot more resources and more capacity, and they do play a role in homelessness implementation, managing the problem and tackling the problem. But they do so without having anything like the legal responsibilities or powers that you're familiar with in the UK. So services to homeless people are mainly provided by non-government organisations, the voluntary sector as it used to be called in Britain. And they are primarily doing that under contract to state and territory governments funded by those entities, and some of them with some philanthropic funding as well. Faith-based organisations are a big part of that. They have a much more important welfare services provision role in Australia than they do in the UK, and homelessness is just one aspect of what some of the big faith-based organisations do. Next slide. So some of the factors affecting the rate of homelessness in Australia. Australia does have a significant problem here. Of course, these things are always very hard to compare across countries, but I'll try in a moment to do so. But the fact that I'm claiming that we do have a significant problem in this respect here, I think reflects a number of things, especially the four that I've highlighted here and two sort of sub-points. Firstly, we do have relatively unaffordable housing in terms of the relationship between typical house prices and rents, the relationship of those costs to incomes. We do have relatively low level of or low rates of payment on social security benefits. Our equivalent of job seekers, the job seekers payment in the UK is the lowest in the OECD in relation to incomes. We do have a very, very pale shadow of the housing benefits system that you're familiar with in the UK. It's called rent assistance, but it's minimal by comparison. The level of rent assistance payment, the typical rent assistance payment, is far below prevailing rent levels, and it's especially inadequate in the capital city housing markets where rents are typically a lot higher than the national average. And so the fact that it's capped at a national rate, it doesn't vary in more expensive housing markets, makes it even more problematic. The other thing which I think is critically important is that social housing is a very, very small part of the housing market here. 96% of housing is private housing. So we have this 4% social housing sector, which is a mixture of public housing run directly by state and territories, and a very, very small part that is the not-for-profit equivalent of your housing associations. Move on. Thank you. So the rate of homelessness is primarily measured by the census here. So we only get it once every 5 years. However, in the last census, which was in 2016, we could see from that the rate of homelessness measured in that way had been running substantially ahead of population growth for at least the last 10 years. Street homelessness, which is also measured, or rough sleeping, was also measured through the census, as well as in other ways, but primarily the census. That's estimated as double the English level, just in numerical terms. So the last census told us that we had 8,000 rough sleepers on census night. When you bear in mind that Australia's population is only 25 million, that means that the rate of street homelessness is about 5 times what England has, if you believe the official MHCLG numbers. Of course, we do have a climate that makes it slightly less challenging to be sleeping rough, but these numbers come from a census which is always carried out in August, which in this country is winter. And in some parts of Australia, certainly including Melbourne, winter means something. It's not sunny and hot all the year round by any means. Next slide. So just to say something about recent policy and practice developments, and this is really where we're starting to pick up from the Homelessness Monitor 2020. There has been, I think, a very noticeable step up in the attention that state and territory governments are paying to street homelessness in particular. Not so much homelessness more generally, more broadly defined, but street homelessness has been recognized in the last, I'd say, 3 or 4 years, much more something that state and territory governments really have to get a grip on. And I think that comes about for a variety of reasons, but one reason is simply that the numbers in city centres, I think, reached or went past some sort of threshold where it was becoming harder and harder to ignore it, and it was becoming more and more of an embarrassment, especially to a country which is, in normal times, although not now, highly dependent on overseas visitors and in an international image. It's extremely bad for your image to have rough sleeping in a way that can't be ignored. And rough sleeping reduction targets have recently been adopted by some state governments during that period, just the last few years. That was never the case before. And I think this is all to the good. It has, though, raised all sorts of questions about measurement and monitoring of progress or otherwise against whatever target it is that you've committed to. Next slide. So in some cities, and this is something which is entirely homegrown, there is a kind of national influence that's affecting this. And I'm talking here primarily about the Institute of Global Homelessness based in Chicago, but also American influence more generally. The NGO service providers have, I think, embraced in a really quite enthusiastic way in the last maybe 5 years, perhaps, a lot of what I could call technical innovations, partly around this, it's prompted because of targets and how do we measure whether we're getting there. And these are innovations about how you measure homelessness at any one time or over a period, how you assess vulnerability and support needs of individuals, and how you prioritize one individual over another for attention. And this wonderful acronym, the VI-SPDAT, is on everybody's lips in the Australian homelessness support industry nowadays, and is this technique that you may or may not be familiar with in the UK. I had never heard of it in the UK, and I think it's a tool that was in fact only invented since I've been in Australia, but is, I think, came from the US as well. And partly through using that technique, there's been a lot of enthusiasm around establishing local databases that are shared across organizations. And in Australia, terms of a know by name list, it's called, but it's a system or a database. Next slide. And the final policy and practice slide, you'll be pleased to hear. Some concerns, I think, within the industry, though, or within the sector. Some of these developments are controversial. There's been quite a lot of people are concerned that these kind of directions, the very specific focus on street homelessness, rather than the broader issue, and this message that better data is a pathway to homelessness solutions, and it doesn't require necessarily bigger changes, which I think a lot of us would argue it does. That's generated a certain amount of controversy and debate, we could say at least. And so what it is, it's about anxiety that these directions may actually be a barrier to understanding the wider issue and the systemic reforms that are really needed as an upstream solution to this issue. So evidence-based policy commitment is reasonably strong on government-funded homelessness projects and techniques. If you look at the most recently published homelessness strategies that a number of states have published over the last 3 or 4 years, they do, speak the right language about needing to the justifications that they give to why they have decided to put a few $100,000 or occasionally millions of dollars behind certain initiatives. So there is some sort of affinity to that way of thinking, but the political recognition or will to make significant structural reforms is a lot harder to see at the moment. And really, that's something that can only happen when it's led from a national level. So it's all very well to have more or less, perhaps a more progressive governments running the show in a particular state or territory, but it's pretty hard to make a significant impact if you're not working in collaboration with the national federal government and looking to do the same or aiming in the same direction. And so what I'm talking about here is the sorts of things would include expanding social housing, at least trying to restore some sort of program that keeps up with population growth, because we're miles behind doing even that. And the social security payment rates are equally a problem. Next slide, I think it's the final one. So some of the implementation issues which I think are raised by what I've said, or that are around this issue, are about the semi-professional, the amount of voluntarism in our homelessness services sector is much greater than in the UK. There's a lot less regulation, I think, than there is in the UK, or service standards and that kind of thinking is quite a new thing in the sector in Australia. The prevalence of short-term funding is a real barrier to capacity building investment. If you're never sure whether you've got funding beyond next year, it's very hard to plan that kind of commitment. And there's a very heavy reliance on contractual conditions. That's how states aim to embed or pursue policy, and the occasional retendering of services that is always expected to generate a great dividend, which we can then spread a bit thinner across other services. The COVID experience, though, has been a huge stimulus to collaborative working, because we've seen the same kind of emergency rehousing program that took place in England in March and April. So there was an extraordinary few weeks where governments all of a sudden discovered that they could afford to create a temporary solution to this problem anyway. And the NGO service providing organizations were ready and enthusiastic to help in that, and indeed pushed some governments into actually taking the action in the first place. And the collaboration that's developed as a result of that, at least over the last 3 to 4 months, is on an extraordinary level. And I think there's a reasonable chance that may have some positive enduring impacts. And it plays to one of the issues that Robin's presentation mentioned in particular, that this is implementation is a team sport, And the team sport nature of this activity is something which has really come to the fore in the public health emergency situation. Thanks very much. Back to you, Ligia.
Thank you so much, Hal. And I guess perhaps a useful way of starting the discussion would be to ask Robin whether there are any examples at both local and national level of when, say, leaders were going about their business in the usual way and perhaps thinking they were already, using implementation and planning that was effective, and then trying to embrace and build implementation science into their ways of working. What did they do differently? I think some examples will help, people joining us, think about the types of things they could do in addition to the usual planning they already do.
Yeah. There are tons of examples, and there's a lot of examples in the UK, right down to the UK Cabinet Office having an implementation team for quite a while. They were using a thing called Deliverology, I know, developed by a very famous UK citizen, which has some elements of implementation science, but implementation science has sort of accelerated past that to be able to tailor to things more to context. But to just make it really concrete, what often happens is people discover implementation science out of a number of failures, including myself in my career, where a lot of money is spent. We have these great sort of innovations and evidence approaches. There's a lot of money spent on training and little else, and maybe a platform for dissemination of some sort. And some smart person follows up later, gets some data. It goes back to the point I said before, data really does help unravel some of these things. And you either see that it's disappeared or something totally different's in place. It's also, people tend to come to it out of being a bit exacerbated about the continual spend of money, or the what we call in Australia, the shiny object. So I was really into this thing before, and now I'm like, I like that thing over there. So I often say, innovation is implementing things that have an evidence base, full stop. So we should try and stick to that and sustain it. But what then happens is either a local government, a community service agency, and or a government will ask for some support to think about how implementation science can help them. And that step often looks like wanting a manual. So we've been asked to write a number of kind of guidebooks or manuals. One of them is with the Education Endowment Foundation. We supported them to write a sort of a guidebook for implementation for schools. And that's sometimes helping people get used to the concept of what is implementation science. What are these frameworks? What are the steps? So if you go to the EEF website, that's up there. Now, unfortunately, like training, the dissemination alone of products and or is insufficient to get it's important, but insufficient to get the implementation results. So it often raises awareness. And then people understand that implementation is a process, not an event. So it's something that you need to put a plan in place. You need to be focused on the implementation, use data, similar to what sometimes organizational change people do. So people will either have groups like CEI, and there are other groups that do this as well, come in and train people in how to use implementation science in practice. So what frameworks could they use? What would the implementation teams look like? What data? And then sort of leave them to it. Or they might deliberately bring in increasingly known specialists in implementation science to work alongside. So at the moment, we're doing a very large piece of work, both the Singapore government, the Australian government, where we are the implementation science. We're bringing that capability, partnering with them and the local service agencies to enhance their implementation plans. They often send us big Gantt charts, and we try and sort of turn the Gantt charts into something a little bit more scientific. And often we're trying to help with data. So it's really also tailored to site and context. So there's no kind of one way to start. So they're often looking for a map and a project management activity. And this is really a way of kind of working through deciding what the best innovation is, planning for what implementation strategies should be put in place, putting them in place and doing some quick try testing, and then looking at sustainability. So we have a number of different case studies we could send, as again, even if you looked at, I mean, the implementation science literature online has exploded. And often people who have a background in systems change, organizational change, or kind of a lot of experience in governance systems come to it quite naturally. And there's a lot to test in implementation science. It's a new science. There are a lot of implementation strategies put in place that there is no evidence whatsoever behind them. And so we also argue, you know, we need to test the implementation components at the same time. So that's, I'll stop there.
Thank you, Robin. And Hal, this really brings to mind the fact that certainly in UK, we have a very rich tradition of the causes of homelessness, and obviously you're helping to build that in Australia as well. So a good understanding of what the structural causes are. What do you think the opportunity might be around, you know, adopting some of the tools that Robin is talking about to help, you know, drive some of the changes that, you know, are well intended, but, you know, when it comes to really creating that headspace and investment in supporting people actually working in local areas, you know, do the best they can when it comes to the quality of services or access to different types of support. What do you think the biggest opportunities might be?
I think there's a lot of scope for improving data, basically. I mean, it's all very well. Although it's, as I mentioned in my comments in the presentation, that there's been a great attention, I think a big step forward at the you know, at the sort of local level in a few places across the country around street homelessness. The broader homelessness concept isn't being measured very well. For a start, you know, we have this. We've got, as I mentioned before, primarily a strong reliance on the census, which only comes around every 5 years. Beyond that, we do have a service use based stats series as well. So that's something more like what you're familiar with in the UK, with annual or quarterly statistics from central government that come from local authorities. How many people have we had through our doors in the last quarter, and what was the outcome on each case? So we have a sort of pale imitation of that, which comes from which, because local government doesn't have a significant role in this, doesn't come from local government, it comes from the service provider organizations, big and small, highly professional and highly organized and not, shall we say, very, very fragmented. 1,400 data points across the country, I think it is. It's, you know, it's absolutely enormous. It's much harder to manage as a method of collecting data about your caseload. And some of the most, to us, interesting variables within the data set around housing history and immediate cause of your problem are not well classified. So that's a very basic, I think, weakness that we have, because this is something the census can't tell you, because the census is a demographic instrument, and it can't ask detailed questions about your history that will give you some indication of what led you to where you are now.
Thank you. And I think we'll start asking some of the questions from the participants. And Jane Lewis, she raises the question exactly of data and whether we need to focus on improving it and what forms of data are key to effective implementation. Now, the second part of the question, we'd love to know what you think, Jane, and obviously Robin, but certainly it's been well known for a while, and certainly the pandemic just made that even clearer, that there's a huge appetite right to use data, and yet the data we do have is often not fit for purpose, in particular when responding to something that is constantly changing, a situation that's very changeable. One of the things that we've identified really as needing change is the data infrastructure. And we've been working with UNS and other partners to develop a homelessness set of indicators that can help us not just track outputs, but really help understand whether we're creating the right conditions to prevent homelessness. And after a period of extensive consultation, it's become quite clear that there are many areas that everyone agrees, and the evidence supports that to be the case, that we need to understand in order to prevent homelessness at systems level. And yet currently no official data exists to speak of. So the next phase is very much about starting to identify ways of doing so at both local and national level. But I suppose the question then is precisely what Jane talks about. Do we already have a very clear sense of what we would need data-wise, data points, when it comes to then understanding whether something is being implemented effectively? So might there be a way of bolting on some data points into a framework like that to help us understand not just the trends, but whether something is being implemented properly? Robin.
Yes. I think sometimes just, well, I mean, gosh, I almost want to make sure, because again, context matters, but when, just as an observation, if we remember the 3-egg thing I put up, sometimes we, in most things, so, you know, child protection systems, mental health, we tend to start talking about data and then we talk it as a systems level. And then we have a lot of people very far away from the actual implementation, deciding what data is required to track something. And if you talk to practitioners, a lot of it's meaningless. It's like that doesn't help. Like, a way to put practitioners off collecting data is to get them to collect useless data that they can't use to help monitor how they're, help inform how they're going. And so, and there's a number of commissions we've worked with where we've advised on this. It's about data at all levels of the system you need to impact. So by just not solely, but say as the main focus, say we're doing national data, or in Australia's context, statewide data, it doesn't help monitor implementation on the ground, really. It helps track things, but so it's important to have. So we must have that, like the 3 eggs, but we must have data at each level to answer these questions. Are we reaching the people we intended to reach? Uptake is very important. If you tried to get to 100 people and you got to 5, that's a problem, right? That's an implementation challenge that can be overcome if we knew that through the data. So are we reaching who we intended to reach? Are we implementing in the way we thought? And are we getting those outcomes? And you can design ways to capture that data at each of those 3, sometimes even 4, if we're talking about end user data more meaningfully. So if you think you could have even an egg inside the egg, that's often our constant response. I'm asked to comment on the implementation of some initiative by looking at national data. So if you think of early childhood, it's tough. We're sort of, and sometimes you're monitoring a system that's sort of broken. So again, if you think of child protection, using administrative data, which is quite common in systems like Australia and the UK, is basically tracking a system that's not working well. So we've just got to be a little bit more pragmatic. And then without contradicting myself on the data point, it's so tough. If we put all our eggs in collecting better data because we think it's going to be the answer, and we don't use other implementation strategies, so data collection and use is one of those 80 I mentioned, we're going to be still here spending a lot of money collecting data that isn't usable. So it's, again, thinking about what are our other implementation strategies in addition to data collection that we should be putting in place to see if we get that effect. So I'll stop. How?
Yeah, I mean, there are so many basic gaps in that we sort of, I think it's easy for a UK audience to, perhaps take for granted some of the series that you have access to. I mean, take evictions, for example. I mean, we have a tribunal system of for determining whether a landlord is allowed to eject their tenant, and that tribunals exist in every state and territory, and they hear cases and they make decisions. None of that data is published. There are no statistics that come out of that on a routine basis. It's just you know, the raw material is all there. It's just that the commitment to utilizing it for very useful purposes doesn't exist, or, you know, that there's been pushback against that. Another one is tenancy sustainment, you know, like a sort of critical question of how enduring is the solution that you've created for somebody if you've managed to rehouse them out of rough sleeping or any other form of homelessness. How can you measure whether you're doing it better than another organization or better than you were last year? By measuring the enduring, how long tenancy is surviving, or the percentage of tenancies that are set up which are still there a year later. We don't have any tradition of doing that. There's no national or even state level metrics on those things, let alone any sort of routinely published statistics. So, you know, there's quite, I mean, I think these things are fairly basic, but, you know, they're things that are, I think, a big problem.
Yes, and certainly that idea that without understanding the needs and whether the services in any one location actually match that need, or whether maybe we should stop doing some of the things that we currently offer, it's very challenging to then, you know, improve impact. And certainly in UK, we still share very little data across local homelessness systems, which is one of the very basic things that could be done to help improve the quality of the services we deliver. But I want to ask a question from Dominic Williamson from St Mungo's, and he asks about policy change, and he obviously mentions how often it's driven by short-term political considerations. So how can campaigners best convince politicians and officials to take a longer-term view that includes setting and systems barriers over the long term?
Oh, Dominic. That's a tough question. I would like to know that too, I think. I'll just say one thing, because we face that all the time. Election cycles, minister changes. I mean, it's what we have found some success in, but I need to be really humble here because it hasn't happened all the time. We've got one live example now with some work we're doing, but is actually, it's a bit sobering and slightly frightening to systematically assess barriers and facilitators using known valid measurements. So one thing implementation science has done and is contributing to is developing tools that have some validity and reliability. So they would test the same thing on a retest, and a few of those nice things you're looking for when you look at how measurements are developed that offer cross-country comparisons, but also give us data that's a little bit more reliable to use than to influence, because it's nothing like being able to say, well, that's not true, that didn't happen. It's like, well, it kind of did, because I've got this. My experience of doing that with some levels of, especially government, is sometimes that's not a very nice story and difficult to hear. So it can be leadership challenges that come up commonly in structured barriers and facilitator comments. That's not a fun message. It can be workforce turnover, and so we've had the cool thing about implementation science is it's a science that's growing, so it gives us a little bit of something to kind of hook our hat on. But I mean, again, we've had limited success. We have just been doing this forever, and my hair used to be dark and now it's blonde because it's grey, just to try and get this done. So it's a terrific question. Hal, what do you think?
Yeah, the million-dollar question, of course, but it is sort of about millions of dollars, really. And I think, I mean, this is the language that treasuries understand, and I guess politicians, governing politicians anyway. If things are costing too much, and homelessness is an expensive thing to allow to happen, or at least chronic street homelessness. It's sort of harder to make this argument when you define homelessness more broadly, but chronic street homelessness is expensive, and it's been demonstrated very convincingly by my co-author I mentioned earlier, Cameron Parcell, in his paper published in 2016, I think it was, where very conclusively he demonstrated that the cost to government of allowing a continuation of long-term rough sleeping was greater than spending also significant amounts of money on supportive social housing to avoid those or to enable the avoidance of those costs. I mean, and we're talking about the judicial system, prisons, and health primarily, that are expensive when it comes to chronic rough sleeping in particular. So I think that's the first button to push. I mean, I think more broadly, what we're still on the financial message, we're spending this year, Australia will go past $1 billion per year in emergency, the cost of the emergency homelessness system, or it would have done before COVID came along and actually created a much higher number, which is going to be a one-off. And that number's been increasing by 7% a year in real terms over the last few years, which is maybe $1 billion across a country this size is small enough that, it can be, and it's split across 8 jurisdictions, so maybe nobody really notices it, but I think that's not sustainable. So those are the big and sort of rather hard-nosed answers to the question. The bigger politics of this, though, I think, is about building coalitions and about building alliances of civic groups, of stakeholders who maybe some of them are more directly involved in it, like the service providing industry itself, like the social housing providers, but also like business groups themselves, who and the sort of city authorities that aren't that recognize that it's, as I said earlier, a kind of civic embarrassment that this is a problem which is big and getting bigger.
Thank you so much, Hal. And we're going to have to wrap up, but I want to give the last word to Robin. Any top, what are the 1 or 2 key things you would tell to leaders at both national and local government level if they wanted to find out more about how implementation science can help improve the work they're doing?
Well, just understand that implementation is not the thing you do at the end. Right, so it's not you kind of come up with the innovation, and then someone else will implement it. We'll fund through contracts to different services, and they'll figure it out. But it really matters, and there's a lot of good research to show that a well-implemented intervention with average evidence, so it may not be kind of full, but average, can outperform a poorly implemented top-tier evidenced intervention, which makes sense because you can't benefit from it if it's something you didn't get, right? So it's kind of, I mean, we sort of push that quite hard, and there are some continual structural and systemic barriers that we would all be familiar with that have been around for a while that we continue to repeat. The way governance structures worked, way hierarchies work, the leaving aside the lived experience, the actual people that matter at the end of why we're doing all this.
Robin, I think one of the challenges to that is that it's easy for politicians to fail to recognise the follow through that you need. The announcement
it's super easy.
The announcement is the exciting thing. The follow through, well, we know, let's move on, go on to the next thing. And it's maintaining the focus on an issue, on how you deliver that announcement, the deliverology that you mentioned earlier. It's too easy a lot of the time to be.
However, when we hang around for long enough and we commit to the mission, we can hold their feet to the fire a little bit. And because I'm dealing with a chief advisor to a minister today that's pretty cross at something we said around evidence. And I said to him, buddy, I'm not going anywhere. I'm good. That's the message. You can announce whatever you want in the background. So that goes back to the coalitions. You find these precious people in government and policy areas, and you keep this. So I have these long-term relationships with government. You know, they know I'm going to be difficult and say some hard messages, but they also know we're here to kind of help. So I know it's frustrating, and again, the cool thing about implementation science is it's starting to emerge with good data and evidence. And what better time in COVID? We've had more calls around implementation and evidence post-COVID than we've ever had at CEI. Because for once, somebody is listening to science. Well, some countries are listening to science, trying to listen to science. But
And
I know it's tough.
And we're going to have to leave it there, but I certainly think the UK is for sure one of them. And just to add to what you're saying, Hal, that we feel a lot of this work is about changing habits. So it's definitely not just politicians who liked the new thing and the announcement, and then you move on to the next thing without following things through sufficiently. It's just a habit a lot of the time we find in organizations. So how can we help change habits? And we do feel that, you know, implementation science is one of the tools we can use to help break old habits. But thank you so much both for being here with us today, and obviously the important work that you do. At the Centre, we do believe there's a lot of mileage in investing in rigorous implementation in homelessness. And since launching the Centre, we found that leaders across local areas are committed to data and evidence, but obviously change isn't easy. The movement for evidence-based practice is not spontaneous. So how can we, you know, give people as many tools as possible to help change happen? So it was great to have the opportunity to introduce to people some of the concepts involved in this science, but it's a theme we want to revisit over coming weeks and months through the What Works community that we launched last week, and also other initiatives. So if you want to know more about what's coming up, get in touch, and of course also get in touch with Robin and her team. Thank you so much for sharing your thoughts and comments throughout. Sorry we didn't get around to answering all your questions, but of course you can keep the conversation going online using the hashtag CHIFest2020, and hope to see you later today. We have a couple of other great sessions on innovation, when innovation can be very hard, and also about trials in children's social care and what inspiration could derive from them for homelessness.
Nice.
Thank you very much again, all.
Thanks.
And we'll see you soon.
Bye.